Well, good morning, everyone. And once again, welcome to another live this morning. Hope you're having a great start to your day. And we'll say hello to a few friends as they come on here this morning. And let's see who's number one and number two, number three. Let's see if the Trinity is intact. Andrea, Niagara Falls, Brahim. Now let's see, Mike. Hold on. Who's up next? Chantal, number three this morning. Eric. Salut, Madeleine. How are you? Karen, good morning from Peterborough. Kevin, there you are from Oshawa. Nick from our staff. Good morning, everyone. Linda. Oh, how much we love those Lindas. Sandy, Vancouver, Washington. Cecilia, Shediac, New Brunswick. Gertie from Burlington. Diane, Thunder Bay. There's Mike. Frida, good morning. Sharon from Kansas, good morning to you. Carol, West Virginia. And Brahim said Andrea cheated. Jeanette, good morning. Fran from Orangeville, good morning, Fran. Wanda, Virginia. Vera, Newfoundland. And Mike said I missed him. He was up at the top. Maybe that's true. I don't know. Jeanette, how are you from our staff? Jeanette, how are you? Marilyn. Laurie from Alberta. And Lynn, how are you? Caroline, good morning to you. Donna from Newfoundland. And Lakeland, who was that up there? I went by me too fast. Annette. And Bruno, good morning. Bonjour. Nelly, good morning to you. And again, I think it was Doug, but I can't say. Milika, Stouffville. Donna. And Gail, good morning from Saskatchewan. Bev from Saskatchewan. Rosalinda, did I miss you? Niagara Falls, Louise, good morning to you. Karen, how is you from Sault Ste. Marie? Gary, rainy Bolton. Yeah, it's rainy this morning here. Francis from Vaughan. Debbie, Comox, British Columbia. Mary, PEI. Rita, good morning to you. Yvonne from Petawawa. And Rainy, whoever that was, Nancy, Gore's Landing, Kathy, Vernon, BC, beautiful. Norma, Texas, and who was that in Sturgeon? Kathy, I think, but Marianne in the clouds, Francis Marie. Micheline, bonjour. And Mona, how are you? Rosa said I missed her. Beverly, how you doing? Georgie, Halifax, Nova Scotia. Okay, let's get to our questions. Hi, Nancy. And Marilyn, how are you? And Ron is asking, what does Dr. Martin think of stone ground red fife, wheat, sourdough, no sugar bread? Okay? What does Dr. Martin think of stone ground, better, red fife, not sure, wheat, I'm not a big fan of wheat, but sourdough. Sourdough is a better bread. It's fermented bread, less, I would say less, little bit less insulin when you secrete, no sugar bread. Okay, look, when it comes to bread, okay, I have a general principle. And you look, some breads are definitely better than others. And this one, Ron, sounds certainly better. But, okay, first of all, if you're doing the reset, no bread. Now, if you're going to have a low-carb bread, this would be a low-carb bread. Every once in a while, when you're off the reset, okay, I can live with that. But here's my general principle. If you have insulin resistance, if you're in the 93% of the population that has metabolic syndrome, is on the Titanic, you and bread of any kind don't get along. Okay? Look, there's more protein in the bread that you mentioned, Ron, for sure. More nutrients. It's certainly nutrient dense compared to most breads. But again, don't live on it. Don't fool yourself if you're in that 93%. If you're metabolically very well and everything is in really good shape and you don't have, remember the 5 main things, there's more than 5, but if you got high blood pressure, even normal but high blood sugar, high triglycerides, low HDL, belly fat, uric acid, low vitamin D, those are all my metabolic factors. You know what? You and bread don't get along. So again, you can have it as a treat every once in a while, and most people have to avoid because they're in a bad percentage. But as far as breads go, Ron, I would say that's probably one of the best ones that I've seen in terms of all the things that are good about it. But that's my general principle about bread. Hey, we have Rosie's bread there, okay? And it's a very low-carb bread. You can't have it on the reset, but for those of you like a slice of bread every once in a while, okay? That's my general principle. Suzanne, what can cause dry red spots on my face? Well, could be allergy. It could be a number of things. Anytime you see anything on your skin, I have an arrow pointed directly back to your gut. Whenever you see something on your skin, look at leaky gut. So if these red spots have shown up on your face, probably a fungal, I look at the gut. That's me. I've always gone to the gut, leaky skin, and it doesn't matter where on the skin. Okay, generally, Suzanne, that's what I look for. That's why I always start with skin. I start inside out. I start on the inside. Leaky gut, fix it. On the outside, Rivera, I love it. It's our formula with pine bark extract and hyaluronic acid, and it's a tremendous formula. But I always start on the inside. Okay, Ingrid is asking a question. There has been a lot of conversation on social media. Okay, I like that. About parasites being the reason for cancer. Could that be true? What are your thoughts? Well, I'm not saying no, but here's me. The biggest cause of cancer is leaky gut. And the Trojan horse getting into the bloodstream, and that is fungal. Now, fungus and parasites are very, very similar. Okay? Yeast, candida. It's a fungus that gets into the bloodstream. People thought I was crazy when I used to talk about that almost 50 years ago. 50 years of talking about yeast, fungus, leaky gut. And we know for a fact that leaky gut exists now. At one time, leaky gut, come on, the blood has got to be pristine, you'll die. I remember doctors telling my patients, who I said to them, you got yeast. You have a fungus. And I almost felt like saying, don't go tell your doctor, okay? Don't go do that. Why? Because they don't believe it. If yeast slapped them in the face, they wouldn't believe it. They don't study Candida. And it's microscopic. So to them, nah, come on. You don't have yeast in your blood. How does it get there? If you had a fungal infection, you will die of that. Okay? And remember, I got a lot of pushback, and I felt like telling my patient, whatever you do, don't discuss this with your physician. They don't understand it. They don't. And they're not used to giving out antifungals unless you have toe fungus. And they just can't see that spreading into your bloodstream. And now we know gets into your brain and crosses the blood-brain barrier. Parasites are in the same family, in my opinion. I saw a lot of parasites when I was in practice. Stool analysis in the bloodstream. But when it comes to cancer, I'd say it's more of a fungal. I've told you the story of, I'm going to say in the 90s somewhere, it might have been early 90s, I think. I was in Dallas, Texas, and I was doing a TV program because I had written a book on chronic fatigue syndrome, and I was talking about leaky gut even then and fungal. And I remember there was an Italian oncologist. You could hardly understand him. He was coming on I met him in the green room, and he was coming on that TV show after me, I believe. And I talked about chronic fatigue syndrome, and then he came on and talked about all cancers are fungal based. And he used to do biopsies on tumors. And he always saw yeast in there, fungus. That's what one of the growth factors. And it was fascinating to me, the connection, he said, between cancer, breast cancer especially, and fungal. It was fascinating. Of course, he was dismissed. Surprised he didn't lose his medical license for even saying it. But I found that very interesting. Okay? So, that's what I think, Ingrid. I think it's more fungal than parasites, but parasites could certainly be a factor. It's leaky gut. That's how parasites spread. Okay. Sherilyn, I heard about systemic multi-enzyme therapy for joint pain. Yeah, they're called proteolytic enzymes. I like them. We used to have a formula called Jointzyme, and they were proteolytic enzymes. And I got good results with that. But I get even better results with my inflammation formula, and everyone pray that it comes back rapidly. Okay? But I like proteolytic enzymes. I really do. I actually wrote a book about it, I think. Let me just look behind me for a second here. If I can find it. Yes. I see one up in French up there. Jointzyme. I don't know if you can see that over my shoulder or not. But anyway, it is up there. I did write a book about it one time. Proteolytic enzymes. Very anti-inflammatory. I love them. Okay. Sherilyn, that was a good question. Thank you very much. Anna and Yvonne, together asking a question. I like that. Recommendation for chronic venous insufficiency. Okay? Now, how do you have trouble with chronic venous insufficiency? When the blood pools in your legs and has trouble coming up. Remember, your veins send the blood back up to the heart. And it can pool. It's not dangerous per se, okay? It's not dangerous. Unlike, anything in the arteries, any blockages, you can get, a blood clot, and that can be very dangerous, get up into the lungs, pulmonary embolism, and whatever. But veins, you got little wee valves in there, and they're like little pumps to pump that blood back. And a lot of times, you can get a venous insufficiency. And that can be, it can affect you for sure. It can affect the quality of your life. It's not life-threatening. Here's what I found generally. People that had chronic venous insufficiency were low in guess what vitamin? Vitamin D. Vitamin D. I saw it a lot. They were low in vitamin D. I used to give them vitamin D. I found Navital to be very good for veins because of elevating nitric oxide. And, And move. And drink water. Water is important. Like you would think, well, what's water got to do? Water's got a lot to do with it. So vitamin W and move. Active. Walk. Very, very important for chronic venous insufficiency. Now, Louise is asking a question. The first part I don't understand. My question is TUDCA. What's that? Tudka. My question is, there's something, the meaning there, Louise. I don't know what it is, but I know the other part. Okay. So maybe you could tell me what that is. I don't have a gallbladder, and I hear without it, you do not absorb supplements. Is that true? No, that's not true at all. It's not true at all. Because, listen, you have to understand your gallbladder is only a reservoir. I mean, you have one or you don't. But if you have a gallbladder, good for you. But if you don't, the gallbladder doesn't produce anything. It's just a sac. It's a reservoir. Okay? It's a reservoir. And so your liver is what produces bile. Now, if you don't have a liver, now you're dying. Okay? You don't have a gallbladder, you're not going to die. And millions of women, especially, don't have a gallbladder. Now, if you don't have a gallbladder, you got to be a little bit more careful with fat and fat-soluble vitamins, but you're still absorbing them because you're still making bile. You're still making bile because your liver makes bile. So you are absorbing your fat-soluble vitamins. Vitamin D, vitamin A, vitamin K, yeah. Okay, K2, fat-soluble vitamin. You need it. You need bile for that. Okay, so Louise, thank you for the question. And Ashley is asking, my mom, she wakes up in the night with a very dry mouth. A lot of people do. That's usually, okay, now look, couple of things. If they're on medications, almost any medication will give you dry mouth. Okay, so I don't know about your mom, Ashley, but that could be an issue. The other thing is postnasal drip. where they get a postnasal drip and they get a very, very dry mouth, or even silent acid reflux will give you a very dry mouth. Okay? So use oil of oregano. It's very, very good for that. And she's drinking 2 liters of water a day. Very good. She's also had a funny taste in her mouth for the past week. Also, she just got over a cold. So she's probably a little bit low in zinc. Eat more steak. I mean, you can actually take a zinc supplement. I have it in my multi-nutrient. And for a bit to get zinc picolinate, I like it, but I'd rather you eat steak. That's how you get. That's how you get zinc. But she's probably actually a little bit low in zinc for the dry mouth and the funny taste in her mouth. Okay, thank you very much for that. Okay, Angie. I have high levels of oxidized LDL. You see my face? Angie? I don't care. If you have high levels of oxidized LDL, that doesn't mean anything to me. Okay? And I'm not trying to be funny. I'm telling you that that's, in my opinion, it's not what I'm looking at. Okay? When you tell me about your blood work, I'm not looking at LDL. Well, I'll look at it. I want it to be high. I don't want it to be low. You need high LDL and you need high HDL. Okay? Just the opposite of what you're being told. Now, they want me on inhibitors as I have atherosclerosis and familial hypercholesterolemia. Okay, the atherosclerosis concerns me. The familial hypercholesterolemia does not concern me. But your atherosclerosis does. Did they measure that via what kind of, did they do a calcium test? What did they do to tell you that you have atherosclerosis? I'd be interested in that. Okay, send me an email at info@martinclinic.com. Tell me how they came to that diagnosis. Now listen, okay, I'll never tell a patient not to do anything. I don't do that. Okay? But what I'm really interested in, Angie, okay, really interested in, get me your triglycerides and get me your HDL. Okay, those 2 things. If you have it, and if you don't, try and find out what your CRP is, your C-reactive protein. That is very important. How much inflammation you have in the body. Okay? And, okay, what can help with the inflammation and plaque? Well, here's what I would do. Okay, here's very preventative. I love high DHA, omega-3. Okay, high DHA. The DHA is so anti-inflammatory. I would have you on vitamin D. You know, as far as I'm concerned, somewhere between 8 and 10,000 IUs if you have atherosclerosis, because vitamin D is very important for that, with vitamin K2. You need to be on vitamin K2 because that takes calcium out of the bloodstream. Okay? And I would have you on Navitol. Those would be the most preventative thing. And watch your carbs, watch your sugars. But if you could get those numbers for me, then I can give you a better idea, because you having high levels of oxidized LDL, for me, it's not significant. For doctors, I understand. That's what they're trained in. They're trained in I listened to a physician this weekend tell a patient that they got to lower their cholesterol. They weren't asking me because I would have talked to them about something different, about lowering their triglycerides and upping their cholesterol. Okay? So thanks for the question, Angie. But if you send an email, info@Martin Clinic, I give you a little bit better idea, okay? Kathy, my A1C is at 5.7. I did the reset in January and eat low carb now. Used to be a sugar girl. It used to be 5.3. I'm surprised by my A1C now. Any thoughts? Yeah, Kathy, you're weird. Okay, I'm teasing. Look, Kathy, when did you get this? Okay, your A1C was 5.3, 5.7 recently, I'm assuming, and it used to be 5.3 when? Okay, because if you got off the reset and then started eating more carbs, your A1C could have gone up. I need to know that because in order for me to give you an educated answer, okay? But when you do the reset, A1C usually goes down, almost invariably. Tens of thousands of people would testify to that. Now, again, I'd have to know a little bit more detail. And if you do have, Kathy, if you got your A1C done, did you get your triglycerides done? Do you have a comparison with that and your HDL? I'd like to know all that. Okay, thank you. Give me some more info, Kathy. But, and you're not weird, okay? Unique, maybe, but not weird. Okay. Roxanne, I used to take bioidentical estrogen and progesterone cream. Does this have a long-term effects? Maybe estrogen would more than progesterone. I mean, I'm not big, okay? And I don't know if you know this, Roxanne, or not. I'm not big on giving women even if it's a bioidentical, I'm not big on giving women estrogen. I never have been, never will be. And there will be nothing to convince me otherwise. I am very concerned about any extra estrogen given to a woman. We live in an estrogen-dominated world. They're called xenoestrogens. Now, they won't elevate your blood estrogen, but your body thinks it's estrogen, and every plastic, every chemical, almost everything that is man-made will elevate your estrogen endogenously. And all I'm saying is that I'm very, very concerned about that. I don't like extra estrogen at all. Estrogen makes you a woman, but it's also a growth hormone. So I'm very concerned about giving any extra for breast cancer or whatever. I'm big. I like progesterone and I like elevating it. So if you look at our menopausal formula, that is to elevate progesterone and then I dim out the estrogen. It's to level it out. Okay? So I know I repeat this a lot, but I'm not big on a bioidentical estrogen. I realize that it is like a natural estrogen, but I really don't like it. I don't like it. And I doubled down on that. I just never liked it. And I knew naturopaths and even doctors gave out estrogen in a bioidentical form. It's certainly better than just giving you estrogen. But I never was big on it. Okay. And that was Roxanne. And you're taking the menopausal formula and flaxseeds, good for you. That'll get rid of extra estrogen. Good for you. Sandra, I have a detached vitreous. Okay. Eyes. Sandra, circulation. You got a detached vitreous. Get your blood circulation in the eye. You really want the high DHA. I love the combination of DHA and Navitol. Pine bark extract, the best thing since sliced bread for your eyes because of what it does to the blood circulation and what it does, high DHA, what it does to make those blood vessels slippery and not sticky. And I'm telling you, that combination, I've never seen anything come close to it, to be honest, from a natural standpoint. Okay? That's what I recommend. Sandra, okay? I think I got all the questions today. Yep, I think I answered everything. Okay, guys, we love you guys. Thank you for asking such good questions. We love you. We're so thrilled by our audience, and you guys are great. And if you have any questions, send them in to info@martinclinic.com. If you're not a member of our private Facebook group, please join. We'd love to have you. What a great membership. People giving their ideas and good discussions, and we love it. What a club. Okay, over 21,000 members of that club. Okay? So, guys, we love you dearly. We'll talk to you soon.